Welcome to my channel again. I have prepared for you a new lecture. I sent this is lecture as PDF in my Telegram channel, Medical School number 1. Not be worried, you can see this channel link in my website named by Dr. Joe website. Let's begin about glaucoma. I have some notes about this. As you see here, there is healthy eye. VF, there is glaucoma. Structure of the human eye consists of cornea, iris, pupil, lens, ciliary muscles, fovea, retina. Glaucoma definition is a common eye condition that can cause damage to the optic nerve, leading to vision loss or blindness if left untreated. Here are some key points to note about glaucoma. Glaucoma is a heterogeneous group of diseases characterized by optic neuropathy or damaged optic nerve. It's usually caused by ocular pressure, acting on the nerve head. Characterized by optic nerve damage, cupping appear as cupping of the optic disc, a subsequent loss of retinal fiber. Also, as we mentioned that before, there are several types of glaucoma. But at first, we must know about pathophysiology of glaucoma. When there is excess production of aqueous humor or decreased outflow of aqueous humor, increase humor or decrease outflow of humor lead to increase intraocular pressure, and this effect on the nerve leading to ischemia and damage to optic nerve, the loss of vision. So classification: congenital acquired, ISUC; congenital rare, congenital glaucoma, increase intraocular pressure during intrauterine period, and the child is born with ocular enlargement. Infantile glaucoma occurs during third birthday, occurs about 10% of cases. Juvenile glaucoma, as you see. So we have three types. The first two, congenital, occur during intrauterine period, while infantile occur during third birthday, while juvenile between 3 to 16 years of life. Iridodyskinesis, this means maldevelopment of the trabecular meshwork, induced trauma, and we see full thickness of the iris vessels, or any combination of these structures. Normal, there is clear malformation of collarite and abscess of crevices. There is hypoplasia, correctopia, polychoria, seen in this syndrome and iridia. Corneodyskinesis, another term, is mean malformation of the ankle. Iris and cornea posterior embryotoxin means corneoid. So then we have these two terms. Iridodyskinesis means trabecular meshwork abnormalities. We have full thickness of iris. Abnormally, there is absence of crevices, seen in this syndrome and iridia. Corneodyskinesis, abnormalities in ankle, iris, and cornea. We have adhesion and in corneolenticular and iridocorneal. We see also lead to microcornea or macrocornea. Acquired glaucoma, primary glaucoma, include primary open angle glaucoma, as you see in this table. So risk factor for glaucoma lead to increased risk of developing glaucoma, as you see. Genetic factors, family history, aging above 40 years, eye trauma, hypertension, severe myopia, ocular surgery, diabetes mellitus, migraine headache, emotional excitement, caffeine consumption, increase, ethnicity in black people, prolonged use of corticosteroids. Symptoms, as you see here, lacrimation, photophobia, corneal edema, reticular pressure, myopic, okay, corneal diameter more than 30 micromercury. Clinical features of primary open-angle glaucoma includes these. Clinical feature primary closure glaucoma includes this. Chronic angle closure glaucoma, as you see in this. Secondary glaucoma, as a result of another disease as uveitis, inflammation, trauma, and intraocular hemorrhage, previous surgeries, diabetics, steroid medication. The major types include, as you see here, lens-induced glaucoma, glaucoma due to uveitis, as you see this. Diagnosis based on rising intraocular pressure, visual field changes, optic nerve head evaluation. Okay, diagnostic measures, as you see in this lab, but we discuss them individually. Eye pressure, an essential part of eye care. At first, we have this device named by tonometry. Tonometry is not so important. Have many types. Shiotis tonometry, as you see this, and this partis, this rule. Okay, sterilization, and this uses types tonopine, and perkins. In contact tonometer, as you, this is so more common. This is for medical technique, not for doctors. Okay, this is another device named by ophthalmoscope. As you see, it is used. Ophthalmoscope, two types, direct and indirect. Both have some advantage and disadvantage. As you see structure of retina, you see structure of retina and posterior pole of fundus, optic disc, and examine vessels by this device, examine macula. Okay, we have three types. Another type is the distant direct ophthalmoscopy. This part is method, position of the how to use it. Okay, applications. Very well, we see this. This is retina. We see vitreous vessels, linear fiber, optic disc, fovea. Another thing is this is fundus diaphragm. Okay, we see this abnormalities different from this normal. There is black shadow due to hemorrhage. Okay, and blurring of disc margin due to this hemorrhage due to obstruction of blood vessels. Okay, we see here bell disc due to ischemia, disc swelling due to edema, and as you see here, it's named by cup. It's named by cup, and another is by disc. Constrict atrophy. This is term. It is temporarily used when we see progression toward the pulse, resulting in enlargement of cup equatorial circles with retention of round shape of cup. Okay, this is referred to as atrophy or temporal unfolding. It is always temporal, but it caused by lead to enlargement of the circle around shape and convert the pulse to round shape of cup, as you see here. Continued deepening of cup causes exposure of lamina criborsa, which is over-recognized by cryphene. Laminar dot sign. Okay, laminar dot sign is deepening in cup due to exposure lamina criborsa. Okay, so appear as laminar dot sign. Advanced glaucomatous cupping, eventual loss of all neural rim. No, this is also named as beam butt cupping. Okay, characterized by white disc with binding of all blood vessels, as you see here, white disc and binding of blood vessels. Histologic section reveals extreme displacement of lamina cribrosa and the remaining of disc margin. Further signs of glaucomatous optic atrophy. We see hemorrhage, as you see here in this picture, sublingual hemorrhage or trans hemorrhage. Normal tension glaucoma, in patient with normal tension glaucoma. This may come and go and reappear as same site or different sites across the disc margin, but during resorption, we see the papillary portion may disappear first so that an extra papillary hemorrhage remains. The sublingual hemorrhage, which is one sign of glaucomatous optic atrophy. Overpass cupping due to deepening of cup. Okay, we see that it's cup with hemorrhage, but there is collapse of blood vessels. One or two blood vessels curve outline physiology. Okay, blood vessels may be buried from the margin of the cup. Okay, the sign is not pathogenic. It is the presence in glaucoma suspect patient shaded with visual field loss. By the end of the glaucoma, we see collapse of blood vessels. Okay, collapse of blood vessels. Peripapillary changes shaded with glaucomatous optic atrophy, retinal damage, neural nerve damage. Okay, obligatory changes in peripapillary. Okay, and nerve damage, loss of axonal bundles. This is okay, not new. Okay, these defects appear as wedge-shaped or diffuse loss of retinal striations, as you see here in these pictures. You see here in this picture in black arrow zeta beta atrophy, but while in white arrow we see zona alpha atrophy. With some abnormalities, you can download it from my Telegram channel. This is another tool named by Geniuscope, as you see here. Geniuscope. Okay, we have many types, but rule of it is to examine to examine the ankle. We have in these tools too many types. Two types, direct and indirect. Direct have special lens named by copy lens, while indirect we have many mirror, 3 mirror golden, 4 mirror lens Bosner, 4 mirror lens Sussman. Indications in neurons of ankle, history angle culture, as you see, but we examine ankle structure as peripheral iris, ciliary body, sclerospore, trabecular meshwork, Child-Bill's line, where cornea ends. Okay, as you see here in these pictures, patient factors. So we take this for during our examination and our procedures. As you see by this mirror, we can see inside the eye, especially the angle. Okay, we have chamber angle. It includes Sichuan grading, Shepherd system, spine system, CG system, posterior structure, servers to see geometric angle for greatest, spine system to see dimensional, three-dimensional structure of angle level, and it is peripheral configurations. by system classification as you see it in this. It is not so common, so not so very important in your exam. Not be worried, but you can know about it and read this system. Major features study here. Insertion. This is the procedure. Grades for insertion of root of iris anterior to scalpus sign line by the scalpus line on the scleral spore by the scleral spore deep to ciliary body face extremely deep post ciliary body band. The width is estimated by tangential line from iris to trabecular meshwork as is expressed in degree. Okay, not bad. This is how to see. This is only for speciality, not for students. Pigmentation in the posterior meshwork at 12 o'clock position. This to examine pigmentation, if there is heavy pigmentation or not. Indentation or compression. This is the procedure. Other abnormalities in angle. You can see this in PDF. This is the grade of Shaffer's system. We can explain Shaffer's system by this minor only, as you see there. We measure the ankle as according to this diagram. Okay, and according to this, usually we detect the risk of closure. So easy. Shaffer syndrome records the angle. Of course, we know. Well, you see, we will measure the angle and put it in degrees. Okay, according to the diaphragm, as we see here. Grade 0, apex cornea not visible. Grade 1, high risk, but top everything not seen, just 12 line. Okay, grade 2, only trabecular visible. Grade 3, at least clear as poor visible. Grade 4, just ciliary body easily visible, as you see here. Ciliary body is for grade 4. Okay, types of mirror, and this is picture show of the mirror inside this device. Name it by C-spore mirror. Clinical presentation. Habistria. We see breaks in descemetous membrane. Railroad tracks. Curvilinear. Okay, endothelial migratus. This is not so important. Seen habistria breaks in membrane. Seen in stigmatism. Okay, clinical representation copies lens. Okay, anterior iris insertion with the absent angle races. There is edema, can be improved with glycerin drops or even mechanical debridement of the epithelium. Cavity ratio normal less than 0.3 in children. Okay, if there is high intraocular pressure, so the optic canal and is stretching and appearing as a backward bowing of lamina cryporsa. Okay, we see enlargement of cup. Okay, while if there is intraocular pressure reduction due to decreased stretching of lamina cryporsa, okay, so this lead to optic nerve damage. Is the single most confirmatory sign of the control or progression of glaucoma. Another abnormality in this angle, you can see this. Okay. Other pictures to roll out from this device. Another important thing is visual field. Major boundary of visual field. As you see, there is many fields. This is just for normal, and this is when we do when our neck is not right. But if we have glaucoma, we have temporal wedge at early, while this wedge convert to a very large circle called glaucoma, which is dark. A paralytic glaucoma. There, at first, you have central glaucoma and central scrotum. Not be worried. Which shape for early, but scotoma for late. Okay, changes. This is some features. But if it is complete darkness, this is named by advance. Another device, light lamp. For cataract is used also. Light lamp used by eye care professionals to light and examine structures in the eye at magnification up to 4x. Lamp facilitates an examination which looks at anterior segment or frontal structure. We see eyelid, cornea, sclera, conjunctiva, iris, aqueous, natural crystalline lens, and vitreous. Two types of light lamp. This light lamp and has rice light lamp. As you see, there is those pictures. Filters used in slide light. This is not for doctors, just for medical. You can read it. Acute angle closure glaucoma image. Okay, as you see here, normally not light eliminating both sides of the iris, but there is shallow. Look to the people, but look at these people no response. As we side, in nasal side there is darkness. Oh, I am so sorry. Sorry for this. We may have summer breaks. No, we have finished it at least. Okay. As you see, acute angle closure, heavy edematous cornea. Okay, and semi-dilated pupil. Okay. Can be retinal laser treatment. This later. Okay. Okay. Fundus photography. You see it is connected to computer and has code camera. Fundus photography for retinal lesions and macular edema. You see this. Color fundus photography. You see this is normal, but it will appear as normal. Normal fundus have these features. These normal fundus. These are just for normal fundus. Eye with glaucoma, not bad. New retinal rim, as you see, is normal structure. Early glaucoma until it is reached to high grade. Another device is bathymetry for corneal thickness. We see the eye as ultrasound, but it is not ultrasound. Just to examine the corneal thickness, because in glaucoma there is an increase in corneal thickness, or maybe thin. No corneal thickness, it is abnormal, thick or thin. May indicate corneal thinning, corneal edema. Okay. In glaucoma, it will be thick. is lower for thin cornea and higher for thick cornea. It will be thick in glaucoma. Thickness, when it become thickness cornea, it will later increase intraocular pressure. This the last one is optic nerve imaging. This is just for neurology. Okay, 6 treatment development. Before we discuss the treatment, we must to understand development of glaucoma. As you see, healthy eye, we have drainage cornea and flow of aqueous humor. While if aqueous humor is prevented outflow, it blocked, or and this lead to increased tracheal pressure, cause edema and optic nerve damage. As you see here, drainage blockade, increase intraocular pressure, edema, optic nerve damage. At first we must do lifestyle changes toward the healthy. If you have for weight bearing workout exercise, okay, avoid the close card at cafe like this. Abstain from playing one instrument, especially like baron. Eat anti-nourishing food, work out regularly. Glaucoma prevention by these schedule. They have anti-glaucoma eye drops. Those, and also we have anti-glaucoma drug delivery system. Those are drugs for treatment of glaucoma. They are so simple. Vitamin supplement, as you see here. Glaucoma supplement is also here. But in surgery, as we see in development, we must open a way for drainage of aqueous humor by surgery. Or by laser, we affect the trabecular network. Laser iridotomy, okay, definite treatment, highly effective more than another surgery, creative when performed early. When we applied laser to this ankle, okay, to improve drainage route or create a new route. This allows fluid to flow properly without healthy atricular pressure. So, treatment of glaucoma is based to correct increase intraocular pressure. Okay. Trabeculotomy. And at first, we must affect only this drainage, affect trabecular meshwork to get way for the drainage of aqueous humerus. So, easy treatment. Regular eye exams. Signs glaucoma open to close slowly without noticeable symptoms. Regular eye exams are vital for early detection. Treatment is required to help correction. We must repeat these diagnostic measures every 1 to 2 years for usual at high risk. Okay. Thank you for your listening to me.